Hey guys, it's Dr. J. We're going to talk about reflux and GERD and heartburn and gastroesophageal reflux disorder. And towards the end of this video, we're going to talk about a very simple biohack that all of you can try to see if it helps with your heartburn, and something that I've seen work in many cases in my office over 16 years of practice. To get started though, what I want to tell you a little bit about are some medications that I've used in my practice and that, I've developed a little bit of a change in heart over. Early on in my practice, I used to say that there were two particular classes of pharmaceutical drugs that I hated. And I don't use the word hate mildly, to be clear. So what are those two drugs? They are proton pump inhibitors, or PPIs, the topic of our conversation here today, used as antacid medications. And the other are statin medications for lowering LDL cholesterol. And that's a whole nother topic for us to get into. Now, in my wiser years, I've been in practice 16 years plus now, and with that time comes more experience and comes a little bit of a level of understanding of the role and the purpose of these medications. And so these days, I won't say that I hate these medications, but I will say that they're amongst the most overprescribed medications. And in most cases, doctors are either too lazy or too stupid to do the work to actually engage their patients, to actually address the root causes of the problems that patients have. And this is directly applicable to heartburn and GERD and reflux, etc., that we're talking about in this video here today. But the fault isn't entirely with our doctors either. As patients, we're really selfish and we're defensive to the point of deflecting blame or fault from ourselves. It can't be that I'm eating poorly. I don't want to make changes to my diet or lifestyle. We just want that quick fix. That's our fault as well. As patients, we've really got to start taking more responsibility for our own health and do the work to maintain our health and to strive to optimize health span. Rather than waiting for shitty things to happen to us, we need to be taking more proactive approaches to creating positive outcomes and creating opportunities for us to thrive personally and to be able to continue to do the things that we want to be able to do with our health into the future. With that rant being over, let's get back to PPIs. These are drugs like pantoprazole, omeprazole, lansoprazole, rabeprazole. You probably know these drugs better though by their brand names: Nexium, Dexilant, Prevacid, Prilosec, Protonix. Here in Vancouver, British Columbia, Canada, where I practice, pantoprazole is still one of the most commonly prescribed medicines year after year, specifically for GERD and for reflux or heartburn. And like many drugs, they do have a time and a place and a purpose and a context in which they are effectively used. And for PPIs, when prescribed appropriately and when provided with appropriate follow-up, meaning you're seeing your doctor regularly to track and to manage this issue, when used for a short period of time, they can be very effective drugs for managing the symptoms of GERD, gastroesophageal reflux disorder, reflux, and heartburn in general. And I want to be clear. PPIs for short-term management of acid reflux and chronic GERD are an important treatment to consider to prevent the development and the advancement of chronic damage to the lower parts of your esophagus. Chronic reflux and the inflammation and the irritation that comes along with that of the lower esophagus by stomach acid can lead to long-term tissue changes. We refer to these changes typically as Barrett's esophagus when they start to become more serious, and they are a precursor, or it is a precursor to esophageal or stomach cancers. Once you are diagnosed with esophageal or stomach cancer, the prognosis is not good. 5-year survival rates for esophageal cancer are less than 50%, and that's even lower for some forms of stomach cancer. And so what that means is if you are diagnosed with esophageal or stomach cancer, you have a less than 50% chance of being alive in 5 years. Those are not good numbers. Those are not good stats. And it's these stats that drive doctors to simply prescribe PPIs and other antacid medications. It's not wrong, it's just lazy, and it can come with some consequences. Now, these drugs, by design, permanently shut down and prevent stomach acid cells that we call parietal cells from producing stomach acid or hydrochloric acid. This is one of the early feed-forward systems in our digestive process. Stomach acid triggers the release of other digestive enzymes throughout the entire digestive tract, not just in the stomach, but in our intestines. It stimulates the release of hormones associated with proper digestion and metabolism of our food, and stomach acid directly breaks down complex foods in our stomach and helps to break down proteins into their component pieces or amino acids. Stomach acids also prevent many infectious organisms from gaining access to our intestines. It's a protective mechanism against bugs that make us sick. Maybe most importantly, though, stomach acid and an acidic environment are required for the absorption and the utilization of many essential minerals like calcium and iron in particular, just to name a couple of obvious ones. We need good acidity to convert these minerals into forms that we can transport across membranes and into our blood and utilize in our bodies. And then parietal cells also produce intrinsic factor, or IF, which is essential for the absorption of vitamin B12. So when you chronically shut down your stomach cells from doing their job, you are directly impairing your ability to obtain nutrition from food or nutrition from your diet. And so what I'm saying here is that we need to separate diet and nutrition. They are not the same thing. Diet and nutrition, diet does not equal nutrition. They are not interchangeable words. Chronic PPI use then, of course, is then going to be associated with malabsorption syndromes, B12 deficiencies, iron deficiencies, and anemias, messed up bowel movements, poor gut movement, and even infections or the overgrowth of the wrong bacteria or fungi or yeast in your intestines or in the wrong parts of your intestines. Diet does not equal nutrition, and we need to be thinking about optimizing stomach acid in order for optimal digestion. The problem is, though, that most doctors don't prescribe these medications appropriately, which is what we are saying. In my opinion, what that would look like would be that, yes, we can prescribe these medications, but when we're doing that, we've got to make sure we're spending the time on education and teaching our patients about the mechanisms of GERD and reflux, the negative implications of using medications like this long-term, and the clarity on the steps to manage the underlying mechanisms that led to heartburn and reflux in the first place, so that these can be managed ideally through diet and lifestyle. Now, there are some specific nutraceutical supplements and herbal medicines that can be prepared and utilized specifically to manage GERD and reflux and heartburn, so there are alternatives to our PPI medications from a more natural standpoint. But in this video, I just want to teach you guys a really simple little trick that you can use to determine if dangerous stomach acid splashing up from your stomach into your esophagus is really the problem for you, which is possible. Some people that is the case, and antacid medications would be relevant for them more than likely. But a much more common occurrence is the opposite of what Big Pharma wants you to think. Most heartburn, in my experience over 16 years of practice and thousands of patients, is that heartburn is caused by low stomach acid levels or a stomach environment in which its acidity levels or pH levels are too high. Your pH is too high, meaning it's alkaline. Remember your basic school science, your grade school science. For simplicity, pH is a logarithmic scale of acidity versus alkalinity. 7 is neutral. Anything lower than 7 is acidic. Anything higher than 7 is alkaline or basic. Your stomach's pH is supposed to be between 1.2 and 2.5. That is super acidic. We produce hydrochloric acid in the stomach. It's the job of our parietal cells to digest, in order to digest food, to produce that hydrochloric acid. We need that acidity to break down proteins. A low stomach pH environment optimizes the production and the usage of pepsin, which breaks down proteins, and then gastric lipase to digest fats, and then intestinal bicarbonate, which after food leaves the stomach into our small intestine, then our bicarbonate in our intestines alkalizes the food products after being broken down and having initiated all those digestive processes, including stimulating both the movement of your gut to physically break down food, but also to facilitate an appropriate acidity level in the stomach, as we've talked about, required to keep the lower esophageal sphincter, that's the circular muscle that closes the boundary between your esophagus and your stomach, preventing the backflow of stomach acid into the esophagus. So just to be clear on what I'm saying, good stomach acid levels or a low pH is associated with proper closure of the lower esophageal sphincter, preventing the backflow of stomach acid into the esophagus. Bad or low levels of stomach acid or an elevated, more alkaline pH is associated with laxity of that sphincter, allowing some stomach acid that might be there, no matter what its pH, as long as it's somewhere in the acidic range. If it splashes up into your esophagus, it's going to hurt a little bit. And that is the inflammation and the irritation that we associate with heartburn or reflux disorder, or GERD if you want to call it that. So here is the biohack tip. And before I explain this, please do not do this if you have a known stomach or duodenal ulcer, have or are being investigated for esophageal or stomach cancer, or Barrett's esophagus. If you have any question at all about whether or not you should try this, you should not do it. You should talk and consult with your experienced and licensed healthcare practitioner first, as always, who can evaluate the safety of this trick for you on an individual basis. For the rest of this, for the rest of us, the next time that you are feeling like you are getting some heartburn, if you want to test the mechanism of adequate stomach acid being a fix for heartburn, if you have mild heartburn that's intermittent, when you start to feel that heartburn coming on, cut a wedge of lemon and bite into it or suck it, or eat a pickle or two. If your heartburn gets better within a few seconds to a minute, it's likely that your stomach acid environment was actually low in stomach acid or the pH was too high. And so that's how we can determine whether or not we've got lower stomach acid levels and what a fix for that would be from a diet and lifestyle standpoint, or whether or not we actually do have overproduction of stomach acid levels that we need to be addressing. Remember, proton pump inhibitors or PPIs and similar categories of medications like H2 antagonists, H2As, and any antacid medications, foods, or supplements for that matter that make the stomach environment more alkaline than normal, they are going to impair proper digestion and and prevent absorption of minerals. And they're going to prevent the production of intrinsic factor, which is essential for the absorption of B12. Check out my B12 videos for more info on B12 because that's a big issue here and it's one of the most popular videos I have on this channel. So that's what we have as a biohack as far as determining whether or not your stomach acid levels are adequate. And it can be used as a tip or a trick or a hack if you have intermittent heartburn. Try that out and let me know in the comments if that's working for you. I'd love to get your feedback on things. For now, I'm Dr. Mar, and I hope you guys have learned a little bit about heartburn and GERD and are thinking a little bit more functionally about things. I'll catch up with you guys real soon. Hope you're having an awesome day.